Hello, everyone, and welcome to today's webinar. My name is Yannis, and I'm the project manager for AIDS Solidarity Movement for the CORE project. And I will be moderating today's session. Let me share my screen as well. So, hello again. We're happy to have you with us for this 5th edition of CORE Knowledge Hub. Today, we're exploring community responses to PrEP and focusing on cases from Ukraine and Cyprus. First, some housekeeping rules. Please know that this webinar is being recorded, and the video and the slides will be uploaded to the CORE Knowledge Hub afterwards. Please keep your microphones muted unless you're speaking. You may post questions and comments in the chat, either addressed to everybody or personally to Natalia or myself, and we will be reading them out loud later on. Please also state whether you want your name to be shared or not. And also, there will also be, at the end of all 3 presentations, time for everybody to ask their questions and make their comments. A few words about CORE, in case some of you are not aware. CORE is an EU co-funded project that is led by AIDS Action Europe, and it aims to reduce inequalities in the HIV, tuberculosis, viral hepatitis, and STI responses by promoting, strengthening, and integrating community responses that have proven key in reaching communities that are traditionally underserved by mainstream prevention and healthcare services. And Knowledge Hub is a series of online meetings designed to share the community-led perspective regarding community health practices and discuss solutions to the issues encountered. So with this webinar today, we aim to showcase community-led PrEP initiatives from Ukraine and from Cyprus and examine the successes and challenges of advocating for PrEP in settings with limited access. A short introduction to our 3 speakers today. Our first speaker, Mohammed Sarjil, Mohammed is a community engagement consultant at the European AIDS Treatment Group for the CORE project. He's a trained medical doctor with background in global health, research, and programming, effectively connecting evidence-based strategies with the insights of the communities. With over a decade of experience with international NGOs, Mohammed has worked closely with migrant populations, undocumented individuals, women, and sex worker communities, consistently championing a rights-based and inclusive approach. Next person will be Nadia Yanhol, who is a project manager at the Alliance for Public Health in Ukraine. She's a public health expert with over 15 years of experience in the field of prevention and treatment of HIV, tuberculosis, hepatitis, and COVID. She has worked in prevention programs in Ukraine for over 10 years and in the Department of International Programs for over 5 years. Currently, Nadia, within the framework of the ISOS project, is engaged in the sustainability of HIV services in the EECA and Balkan countries, supervises programs for PrEP and HIV services. And last but not least, Christos Krasidis. Christos is a human rights activist, trainer, and international consultant on sexual health. He's currently the chair of AIDS Solidarity Movement in Cyprus, has served as a member and chair of the steering committee of AIDS Action Europe, and as a member of the Copates Network Steering Committee, and is a member of EATG since 2018. Christos is also participating in the ECDC STI Network Coordination Committee and in WHO Europe Workgroup for MPOX as a community expert. In Cyprus, Christos has played a leading role in establishing and running community-led testing services and in representing the AIDS Solidarity Movement in the National AIDS Committee, and he is currently leading our local advocacy for official access to PrEP in Cyprus. So without any further ado, I invite Mohammed to share his presentation.
Thank you, Yannis. Let me put my presentation on display first. Can you see it? Yeah. All right. So good evening, everyone, and thank you for joining us today. As Yanis mentioned, my name is Mohammed Shirjil, and I am representing European AIDS Treatment Group today. Today, I will be presenting the latest European policy updates and tools that can help us scale equitable PrEP access across Europe, but also some insights from the CORE project. So let's begin with some foundational overview of PrEP. It's always good to start. Pre-exposure prophylaxis, or PrEP, is a highly effective biomedical intervention for preventing HIV acquisition, especially in HIV-negative individuals, if taken consistently and according to the protocols. It can be taken daily or on demand, which is also known as event-driven PrEP. Right now, currently, PrEP is endorsed by all major global health regulatory bodies, which include WHO, European Commission for Disease Control, FDA, UNAIDS, all of them. When taken correctly, it reduces the risk of HIV by more than 99%. But then the question comes, but how effective is it across different risk groups? So I think it's very important to mention that for MSM, men who have sex with men, both daily and event-driven regimes have shown outstanding effectiveness. And we know the trials like IPERGAY and PROUD reported a high risk reductions for up to 92%. Many MSM prefer event-driven PrEP due to its flexibility of dosage, and recent Dutch and French data both confirm it's both acceptable and protective when it's used consistently. For transgender individuals, the evidence supports that daily PrEP, especially as event-driven PrEP, has not been studied adequately for those exposed through vaginal or new vaginal tissues. So there's limited evidence there, but for daily PrEP, trials like IPREX show PrEP works, but uptake really remains low due to structural barriers such as stigma, healthcare mistrust, and lack of gender-affirming care. Third important group, which is the people who inject drugs, commonly called as PWID. Daily oral PrEP showed approximately 49 to 50% of protection in a very large Thai study. But real-world data shows very low adherence in this group, highlighting that the need for PrEP to be fully integrated in harm reduction services for the group to get a real benefit out of it. Among cisgender women and sex workers, there is biological efficacy, and it's obviously plausible, but adherence remains a major issue, as shown in some of the key trials like VOICE and FEM PrEP. And the social and social factors continue to act as barrier. So in a very short, PrEP is a very good biomedical solution, but its success is deeply tied to delivery models that not only respect diversity, but also try to look at the structural determinants like stigma, and are all designed with communities with their interest in mind. Okay, then the next slide that I have is a little bit of an overview of the challenge at the Europe level. Europe has a goal of around 500,000 PrEP user goal, out of which currently the ECDC data shows around 285,000 users. What is very important for us to remain cognizant of: women, migrants, and trans communities remain drastically underserved. And in some countries, fewer than 5% of the users are women. So in a very nutshell, we can say that we are facing a twin challenge. On one side, there is underutilization, and on the other side, there are high levels of inequity. With this, let's go to the third one. I think this is a picture taken from the ECDC published guideline in 2021. I think many of you already are aware of it, that there are 10 core principles for an effective PrEP program, which they consider as very foundational to make the program effective and equitable. And these include client-centered access, affordability, informed choices, ongoing engagement with the key populations, and it's an essential tool that any national program aligns with these principles if you really want to reach to the goals of equity and want to serve the communities in the need. Okay, so the latest part for my presentation, I think, is that on 26th June 2025, approximately 4 days ago, ECDC launched its first of its kind standard of care PrEP module. Obviously, it's too early to cover everything here and requires a separate discussion, I guess, to thoroughly go through it. But I just want to highlight a major evolution for PrEP in Europe guidance documents that comes with this document. There is a structured framework which is available to measure and improve PrEP delivery across different settings. And if you look at the standards, I think it is structured in a way that there is a rationale based on evidence, local evidence available. There are some measurable indicators to ensure access and quality. There are some numeric targets that are also in the guidance document, and making it quite a quality care evidence based guideline, which communities can also look and use to hold systems accountable for this. Very quickly moving. Yeah, but I did pull out 3 key points which I found quite interesting, and I just noted in my first read is that there are some of the specific requirements now endorsed under the new framework. First of which is HIV testing must be confirmed within 7 days before PrEP start, either daily or event-based dosing. Second important thing is it recommends a quarterly follow-ups that integrate not only STI testing, but also hepatitis testing along with it. And lastly, I think, which is very important for community-based accountability of health system, is there is a proposal of annual audits to monitor equitable access across different groups which remain underserved, given the traditional roots of how our systems work. I don't want to go into too much of the detail. I just wanted to highlight here that there is a new guidance document available. Please review it, go through it when you have time. Then I think in the next 2 slides, I just want to very quickly say that we often talk about the clinical standards and guidance, but implementation is way beyond that. It's just one part of it, the clinical guidance. It also requires a lot of strategic investment and community leadership, which I think should always be on the forefront to guard the interest. And the ECDC 2021 operational guidance and our own findings from the core project both highlight that there are still major gaps in system readiness to offer PrEP to all groups who are in the need, particularly in regions without urban centers, or, for example, on the healthcare side, there are still so many issues related to the providers lacking PrEP training and proper knowledge and the criteria around this. I go to the next slide. In this slide, I just wanted to say that to reach the SDG goals, I think by 2030, we need to really think about all 4 key dimensions: expanding access, improving testing, and also ensuring rapid ART initiation and promotion of U is equal to U, and address the larger social determinants such as stigma and discrimination more systematically and effectively with the evidence-based guidelines. There are 3 key resources that are available at ECDC website around PrEP care. One is the operational guidance from 2021. There is a monitoring tool from 2022. And then there is the standards of care, as I talked about, PrEP module, which is more comprehensive and launched just 4 days ago. After this, I want to just very quickly, in the interest of time, want to share some of the insights that we have gathered from the core project. This is basically a radar chart which presents a comparative visual summary of community perceptions across 6 different European countries regarding PrEP implementation. Each country's profile reflects 4 dimensions, like in terms of gap areas. One is the policy, second is the access by the different groups, third is the health system's readiness, and fourth is the community leadership. And many of these we know have overlapping determinants and factors, so we can't really isolate, but for the sake of like where we should push, it's always good to where to invest energy to see them clearly. And it's also important to note that the chart does not represent absolute performance metrics, but rather highlights community stakeholders perceive strength or weakness in these domains that I mentioned above. For instance, for countries like Romania, Cyprus, Poland show lower scores in policy and health system, signaling a community view that these areas need stronger investment, commitment, and capacity building to ensure broader and equitable access to PrEP. On the other hand, if you look at the 3 countries on the top, which are France, Germany, and Portugal, appear overall stronger, especially in community leadership, but plays various role in terms from not only advocacy, but also to sustaining services or expanding them to the vulnerable group. However, even in these countries, communities' voices may still see room for progress, especially in sustaining policy support for groups which are still underserved. But as this data comes from the community core project, I think I'm very happy and proud to present that in all of the presented countries, the community voice is playing a crucial and vital role in terms of making the progress forward. And then I would say, let's very quickly look at the cost table as well. It's just a comparative table of the data that we gathered as part of our project, summarizing where the PrEP is available. Obviously, we are talking about Cyprus, so availability, and I know that we are going to talk more about it. But we see a lot of variation in terms of the cost that is very striking when it comes to PrEP. Not only just access, from some countries are offering free of charge to some countries charging even up to 250 euros, and individuals are responsible for paying that cost. So that also highlights how inequitable distribution of PrEP is across the countries. And this is my last slide, but the last take-home message that I want to take from my overview is that PrEP is still a very underused tool due to lack of its integration into community-based and social and behavioral interventions. And obviously, we all know how the systems work. So it's not about like only the responsibility lies on the community, it lies mainly on the stakeholders who fund those interventions. Gaps in equity and access are severe, especially for groups like women, people who use drugs, sex workers, and migrant populations. On health system side, healthcare provider knowledge remains limited, which directly undermines the quality of care and implementation of PrEP. And it's very important for us that to meet the SDG targets to end AIDS by 2030, we must scale up PrEP in tandem with testing, treatment, and stigma reduction interventions. Thank you very much, and we can have more questions later on. Back to you guys.
Thank you very much, Mohammed, for the presentation. Remember that we'll be taking the questions by the end of all 3 presentations. So let's move on with Nadia. Nadia, the floor is yours.
Mohammed, oh yeah, yes, thank you. Just I share in my. Yes. Hello, everyone. Good afternoon, good evening, and just Let me share some experience, lessons, result that we achieved in the framework of our project. It's innovation of sustainability of HIV services in Eastern Europe and Central Asia. And today I just quickly share that we have some of the tools, maybe more some practice stuff, mostly for Ukraine, but also I would like to speak with some interesting intervention and innovations that we have in Balkans countries that very closely to Cyprus, maybe legislation or maybe situation. And just I have no conflict of interest. And let me start a bit with what we are doing in the framework of our project and what the main objects. It's like PrEP demand creation. It's scale up and diversification of PrEP services and improvement the quality of PrEP services in Eastern Europe and Central Asia countries, plus 5 countries of Balkans. For the last 3 years, we just launched PrEP in 3 countries like North Macedonia, Bosnia and Herzegovina, and Montenegro. And it was a very difficult way, honestly, because we just provided and had a lot of meetings with different stakeholders, with community. And this is very unsustainable countries with government, because, for example, for Montenegro, the government change every year, and what we did with previous one doesn't work with new one. So, but finally we just launched a pilot project for all 3 countries, and for North Macedonia and Bosnia, we have sustainability of PrEP services in the countries. So just maybe we just I can answer for more deeply for some question if you're interested for this experience. But next, our tools and what we did, it's community-led monitoring. It's very important and very practice tool for implement PrEP services. We provided for MSM community in Georgia, Moldova, and Armenia, and we already developed it, and we can share this tool for you also if you need it. Also, the big achievement, it's cabotegravir in Ukraine. I just tell about this later. And now we just we can talk, and we just need to develop like teleprep, because this is like for 2025, it's for modern community. It's very important to order PrEP from home, to don't use a lot of legislation procedures like to receive a PrEP like we still have in Balkans country, in Central, even in Europe. I think that we have a big procedures to receive a PrEP that maybe stop client to do and to receive the services. So just let me talk about implementation of PrEP program in Ukraine. And from this slide, you can see that Ukraine had a very big and long experience. We mostly officially we started 2019, but first clients like still received in December 2017. And you can see this small boxes, but all of them like growing every year, despite of crisis situation, despite the war situation. And for example, till the 2021, we had donors funding for PrEP programs, and after for 1 year, we just already transfer this program to government for the public health center of Ukraine. But again, with the war condition, we for this moment and still we have big support of from different donors, from Global Fund, from CDC, from PEPFAR. So for this moment, we mostly achieve our goals for at the end of 2024. It was for 15,000, but we mostly reached 14,000. And let me briefly tell you what we have in Ukraine, and you will see what the variety of services can we provide for the clients, for the community. It's like for this moment we have two types of PrEP. It's tablet form and injectable form of PrEP. It's cabotegravir. And also for MSM community, we have community-based PrEP. We started from the first year of the war pilot and still have implementation PrEP prescribing in prisons. And also we have teleprep. It's a project that provided PrEP during mail. So people, we already have very developed platform. It's Help 24, and in the base of this platform, we just develop some services that client don't need to have any connection with medical institution. It's only consultation, and everything it's the client can use only internet or phone or computer, and just don't need to go to hospital. So if interested, I just can explain more deeply, but after we really support medicals and support hospitals and medical institution. It's develop and provide online educational course for medical workers, and we still have donors support, and it's very important, like case management for most not closely to health providers, to health institution clients. For them, we provide case management. It's like we find the client and support this client from the 0 step to the receiving a PrEP, even after. We just have communication, and we provide like very personal case management. Also, the main success of our project, it's really friendly and good relationship between donors and government organization, because this is like yeah, like not you can meet this in all countries, but in Ukraine, we have a lot of working groups that together decided what to do next, together like trying to help for different, even small cases, small clients, like it's some very nice communication with government and donors, and also community sector. Also, I want to mention that for this moment, this program managed by Public Health Center of Ukraine. It's government organization, and it's very nice to main prevention program like HIV prevention for forget this word, sorry, like prevention program for all key population, harm reduction program, sorry, harm reduction, and PrEP, they're together. So it's like a good connection, and it's the same education for the same social workers, and yeah, and sorry, I forget to mention here that we already have virtual social workers that also can help to explain what is PrEP and can explain where people can get the PrEP in Ukraine, in the cities, how it's get, if it's like any health condition when you take the PrEP. So this is like what we have in Ukraine and how we can support clients, community, and also government. You can see that this is result have very strong and solid base to have this amazing result. Like mostly we get our goal. And also let me tell about the major breakthrough for prevention program in Ukraine. It's of course launching of the pilot project of Kabele in Ukraine. This was very big result for Ukraine because we got this project during the war, and it was a big advocacy let's call like company to bring this in Ukraine, because we really need this for our community, and special when war condition, when the clients can't come and receive the PrEP. Sometimes it's they should remove from the homes, like but anyway, it's like more convenient from all the sides, that it's better to receive a prevention one time for 2 months, or now with lenacapavir for 6 months, than takes every day tablets PrEP. But anyway, it's the same result, but for some reason it's more convenient, and this is like a future for PrEP worldwide. So just briefly explain that we have this project in 2 big cities in Ukraine, and it's Kyiv and Lviv. For this moment, it's only for MSM community, and we just applied for 100 courses, but received for 200 courses. And for this moment, like 166 clients received cabotegravir. And what's the big challenges because it's supposed that we already have the drugs for 200, but for this moment we have like 266. It was for the 15th of May, the figure. But of course, it's if it's MSM community, it's mobilization for Ukrainian men. Also, it's a limited access because it's only 2 cities in Ukraine. Now we just in Kyiv we have 2 spots for the Kabele, and also maybe it's like any time with new drugs, with vaccination, COVID vaccination, even the tablets PrEP. If somebody remember, we have some patients reaction for this. For the injection cabotegravir, we have like some patient had an adverse reaction, and of course it's if it's 2 cities, it's very quickly they communicate with each other, and sometimes it's influence for the program. And of course, what we just understand and can recommend, it's like really quality information channels. It's info campaign for the clients. It's very important, especially if it's new drugs. It's like the main steps that you can do. It's to inform, to provide this inform, to just work with the myths, to answer for all questions, to work with the social workers to study them. So it's a huge info campaign for clients, also education for social and medical workers, and also you should use all virtual communication channels. And in Ukraine, just shortly explains that we had some community workers that MSM guy, and he is like also like a blogger, and he was admired of Cabotegravir, and he was the first client for Cabotegravir. So it was very good tools and advertisement for us, because he used TikTok, Instagram, and in general for this campaign we had 1 million views for all the small videos, for small tokens, for the talks with bloggers, with talks with some of the people that have a big influence for the community. So it was very nice experience and very bright, and we just continue to support this program, and it was really helpful. So yeah, and just if we come back to some challenges in PrEP, it's of course in Ukraine, like with war situation, I just can explain with these two pictures, with these two slides. For the first slide, you can see that clients can receive a PrEP in Ukraine for even during the war. It was 1st of October 2022. More than 200 medical facilities prescribe PrEP. So, and more than 50 organizations help clients to receive PrEP. And the next picture is from yesterday. And you can see that this is 450 drones and 40 missiles during the night in the sky of Ukraine. And in the east, you can see the light gray regions like Lugansk, Donetsk, Kherson, and in another map it's yellow pictures that already we don't have this territory. It's temporarily occupied. So you can imagine how it works and how to reach such result in Ukraine. And of course, it's challenges here like logistics, migration, and of course, medical workers. That also people, and also the forced evacuation that should sometimes even leave Ukraine, sometimes move to another city. And this is also logistics, because you should transfer this drugs, or you should find another one, and clients migration. So it's a lot of daily challenges for our workers, for our organizations, and for our clients. But we still work, we still attract clients, and we still try to bring innovation in Ukraine. We really want to bring lenacapavir next, so we will see. And just from our experience, I want to provide some worked recommendation. It's firstly what you should do. It's really review and update national protocols and national documents in accordance with WHO guidelines. To be, as we tell that, to be prepared for any to be prepared for the future. For example, this month, next month, like in July, WHO also provide new guidelines regarding lenacapavir, and we should put lenacapavir in the national protocols that to be ready for generics if it's happened, for example. Yeah, we should work with government, with government institution to teach them, to introduce them the PrEP, to be prepared. Also integrate PrEP in any health lifestyle program. It's not about HIV, it's not about hepatitis. I'm talking about like family planning, vaccination program. It should be anywhere. PrEP should be in any national guidelines and protocols. Also, it's important to involve family doctors or family physician to recommend PrEP for widely, not only for key population. Decentralization of PrEP, expanding PrEP program outside of hospitals. It's a community-based PrEP. We are also worked with this, and this is like a future step for all our country. The most important things, try to gather all stakeholders, all people that make decision, all communities together to share experience, to share problems. For example, we had some consultation in Kazakhstan. It's also country of our project where we worked, and we will see result after first and second consultation that gathering some different kind of stakeholders from 3 countries in the region, the PrEP like start growing in 3 times, because people learn, people share, people find decision for many problems. And also be very patient with doctors, nurses, community workers. We should like provide them even online training, just as many information that we have, we should provide for them. And cooperation with STIs clinic, and of course, teleprep. It's like more convenient, it's more cheaper, and this is like more easy to do this. But it's more complicated to implement at the beginning. So thank you for your attention, and if you have some questions, I will be ready to answer them. Just let me finish.
Thank you very much, Nadia. We're a bit back on time, but it's manageable. So we're keeping the questions for the very end. And now it's time for Christos. Christos?
Hi, everybody. Can you hear me well? And can you also see the presentation?
Yes and yes.
Great. So let me start first by saying congratulations to the work that is being done in Ukraine. We have been using the example of Ukraine in our advocacy efforts in Cyprus, a lot of times saying that, you know, they have PrEP and they are in the middle of war and we still don't. So just to start and declare that I have no conflict of interest. I'm a human rights activist coming from Cyprus. I represent the AIDS Solidarity Movement. It's a non-governmental and non-profit organization that was established in '89. And we basically work around 4 thematic areas: supporting people living with HIV, HIV/STI prevention, human rights, advocacy for human rights, and community strengthening. So 10 years ago, we started in 2015 the Cyprus Checkpoint, that is basically the information and testing center of the AIDS Solidarity Movement. And this year, we started the Cyprus PrEP Point, which is the empowerment center for people who choose to use PrEP or want to get more information on how to use PrEP, while PrEP is not available in Cyprus yet. So I will talk to you about the journey that we had in our efforts to have PrEP available in Cyprus officially, because PrEP is available in Cyprus, but not officially. And then talk to you about the point that we are now. So we started in 2018. I've seen a lot of names in the chat that I know, but Gus, you will remember the first PrEP in Europe summit. That was the first chance that we got to get to know more about PrEP, to train our members in the AIDS Solidarity movement to get more information. And that's when we decided, after the summit that was in Amsterdam, to run a survey in Cyprus to prove, to have data, evidence that PrEP is available in Cyprus. And we ran this survey that was run in, it was implemented in Europe. It was called Flash PrEP in Europe in 2016. We ran it after getting license in Cyprus in 2018. And we started advocating for PrEP and talking publicly about PrEP. We visited the House of Representatives, the Parliament, and we talked about PrEP and the necessity to have it. And we actually presented some data in a conference. So you see some of the pictures that we had in 2018. Presenting data was quite important, so we could be speaking with evidence. In 2019, we participated in the second PrEP in Europe summit that was in Warsaw. And at the same time, we organized a conference to present the results of the survey we ran in Cyprus. I have to say that that survey that was run back then in 2018 and was presented in 2019, we ran it together with ACCEPT, the LGBTQI organization. It was funded by EECA Europe. And we continued developing capacity and knowledge around PrEP, which was quite new for us, although PrEP had been around, but for us it was quite new. And then we started providing information through the Cyprus checkpoint and through the testing that we were offering. Nothing seemed to be happening until 2024, when we started first to discuss the implementation of PrEP in a more solid way. But what we did was we continued talking publicly about PrEP, going on TV, on podcasts, on radio, on newspapers, and we basically put it out there, saying that we are advocating for PrEP, how important this is, and how wherever it has been implemented, it has worked well to bring new HIV diagnosis to sometimes half. So what happened in 2024, last year, is that in the National AIDS Committee, we started discussing about putting together a plan where the National AIDS Committee would suggest the implementation plan for PrEP in Cyprus. We were quite lucky, I have to say, in the sense that we got the chance to co-write the plan together with Professor Nikolopoulos, who was involved in the first research that we did in 2018, and he was the main person who did the analysis and the presentation of the results in that survey. And we created a plan exactly as we wanted it, submitted it to the National AIDS Committee, and the National AIDS Committee, after discussions, approved the plan exactly as we submitted it. That was done in 2024, last October, and it was the National AIDS Committee that adopted this plan as its own, submitted it to the Ministry of Health, and we just found out a couple of months ago that the minister approved the plan that was given. I think, if I'm not mistaken, we found out that the plan was approved as it was submitted last March. So we decided to go a step further in our advocacy efforts and launch the Cyprus PrEP Point in an effort to now push for implementation of the plan. So what we did in these efforts is we got other organizations and international networks to help us and to endorse us and to support us. We got the endorsement from the European AIDS Treatment Group, from which we also got a small funding to through SCOPE project, the Amplifying Community Voices for Prevention, to prepare some material on PrEP in 4 languages. We got an endorsement from AIDS Action Europe and from local organizations like the Cyprus Family Planning Association, Queer Collective, Accept LGBTI Cyprus, and Cyprus Refugee Council. So what we did is that we put it out that we are announcing this event, and we invited the ministry to present the plan that was approved by the minister, so we could have something out in the public sphere, because up to that point, the only people who knew that the plan was approved was the members of the National AIDS Committee. So by doing this launch and inviting the minister, and we invited Dr. Shakalis, who is the head of the HIV reference clinic and represented the Ministry of Health, to present the plan. In that launch, we also showcased and screened 2 messages from the European AIDS Treatment Group and AIDS Action Europe endorsing our efforts. So we could put out there that these efforts are not only done by AIDS Solidarity Movement, but they are endorsed and supported by the community locally and internationally. And that really helped us a lot, I have to say. It really put things into a new perspective. Now, have we achieved anything? Not yet. We don't have PrEP yet. We have a plan that is approved. In 2026, we are hoping that we will have PrEP. So in order to push further and to be able to make sure that we will have PrEP as soon as possible, we went ahead and we created a series of webinars, meetings. We called it PrEP Month, and we invited 8 experts and people from the community, from the local context, but also from the international context. The first one is Professor Nikolopoulos, who I talked before. Also, Dr. Ioannis Mameladzis, who has been an expert, I think, and involved quite heavily in the implementation of PrEP in Ukraine. Dr. Daniel Ellenbogen, who is infectious disease professor at the University of Nicosia. We asked for AIDS Action Europe to present their work in around PrEP. We approached the WHO in the European region and had a presentation of their guidelines and how to put WHO guidelines into practice. The same with ECDC. Timur Nouri presented the PrEP implementation in Europe. We thought that it would be interesting also for people on the local level to know that PrEP was implemented in Greece a couple of weeks ago, and to get more information of how this was implemented. When I say implemented, I mean it was approved 2 or 3 years ago, basically, and it started rolling out a couple of weeks ago. And from the webinar that we had last week, from what I understand is that it's still an implementation in process. And we are here doing this webinar as well, together with EATG as part of CORE. And I would like to thank EATG for organizing this, because it's really helping our local advocacy. So what does the PrEP plan suggest in Cyprus? The plan basically has some main provisions. The overall approach, I have to say, is that PrEP is promoted as a part of inclusive sexual health and well-being. So in the plan, it says that PrEP should be promoted as part of a broader inclusive approach to sexual health and well-being, with an emphasis on adopting a positive and affirming attitude towards sex. This is quite important in the sense that we have to look at PrEP as a tool that is part of all the tools that we have, and have a positive attitude towards it. The second point is that while PrEP is effective in preventing HIV, it goes beyond just addressing the HIV prevention. It also supports a wide framework of sexual empowerment and health promotion. So the third point is that there are guidelines that come from WHO and implementation models that suggest that there should be a focus on simplification and differentiation of service delivery, which means that we should not make things complicated, because one of the things that we realized is that the main barrier for people to access PrEP in countries where PrEP is available is actually access. So countries have PrEP, but not the people who want it and need it and choose to take it do not really have access to it, regardless of the fact that we announce that PrEP is available. And the fourth point is that in many countries, PrEP services have been demedicalized. This doesn't mean that there are no medical doctors involved, and they are very much involved, and they should be involved in prescribing, but we should also implement a model that simplifies ways for people to use it without over-medicalizing it. So these are the general approaches of the plan. But in terms of accessing it, one of the provision is that everybody who decides to get involved in providing PrEP in Cyprus through this plan, they should receive specific training, specialized training that addresses the needs of the key populations that are going to be served. And we're talking about understanding gender and gender identity and gender expression, respecting and addressing sexual orientation, promoting safer sex practices, supporting harm reduction related to the uses of psychoactive and other substances, including chemsex, understanding issues around chemsex, practicing cultural sensitivity and empathy, working with individuals involved in sex work, addressing and challenging social stigma, and creating a safe and a welcoming environment for all individuals who choose to participate in the PrEP program. So you can see only from that I would say that the Cypriot plan, I really hope that it is implemented as it is and as it was approved. I feel that it really is what the community was looking for. I will go ahead and give you some more information in terms of accessibility and eligibility for PrEP. Another important point is that anybody who decides to ask for PrEP should be able to get it. So the criteria that we have in the plan, that we managed to include in the plan, is criteria that excludes nobody. It means that you don't have to belong to a specific key population or declare yourself as a member of a key population and have yourself registered in the national system as part of the key population in order to access PrEP. So anyone who requests PrEP should be prioritized for access. These are actually the guidelines for WHO and ECDC. And 6 stages of implementing PrEP. So there are specific stages where we start with consultation of the individual, then moving on to taking the individuals who should take some tests for HIV and STIs every 1 to 3 months, 1 up to 3 months. So it's basically to make sure that the individual who decides to start PrEP is negative in terms of HIV. And if there are any STIs to be treated, then the 3rd stage is testing for liver enzymes and kidney functions. That's every 6 up to 12 months, twice a year, basically. Medical follow-up every 3 months, prescription after the medical follow-up, and dissemination of the medication that we are now having the oral confirmation from the ministry that it's probably going to be a prescription for 3 months that can be used on a monthly basis. And then in order to renew the prescription every 3 months, then you have to go through the whole stages of the that we've said there. So repeat the HIV test, not necessarily the enzymes for liver and the kidney function tests unless it's 6 months, and then do a medical follow-up and get a prescription for the next 3 months. And then these stages will repeat themselves and up to the point that an individual decides to go ahead and continue having PrEP. Now, the proposed implementation plan, this is one of my last slides, basically has 3 phases. The first phase is it has a provision of 600 people, 400 for daily use and 200 for on-demand use, and a duration of 12 months. And it includes the Larnaca Hospital, where the HIV reference clinic is, and the Nicosia Hospital, which is in the center of the island. And it also includes us, the Cyprus Checkpoint, in providing counseling to people who are going to be looking for using PrEP and guidance. And this is why the Cyprus PrEP Point is important to play an important role in this, and also to provide testing for HIV, syphilis. We also do hepatitis B and C. And then anybody else who is also interested to get involved, this is the first asterisk, they could get involved. So this is not a closed plan. If there are other local organizations or stakeholders or community groups that want to take part in this, they can participate as long as they are fulfilling the necessary provision of special training. And then we move on to the second phase, where the expansion of access to PrEP moves to all the hospitals around Cyprus. When I'm talking about Cyprus, I'm talking about the south side. That is the area that is controlled by the Republic of Cyprus. But I will talk a bit about the north side as well in a bit. The second phase has a provision of 36 months, and it goes up to 800 people, 500 on daily PrEP and 300 on demand. And of course, the first phase continues when we go into the second phase. And then the third phase is the full expansion, where PrEP is going to be available through family doctors. We have a system, a national health system in Cyprus that in order to go to a specialty doctor, you have to go through the personal doctor and get a referral. So family doctors should be trained to be able to prescribe PrEP. You should be able to get your PrEP from pharmacies that are within the system, the national health system. The private labs to do the testing that goes beyond just the checkpoint. So you should be able to get the tests in any private lab in this third phase. And of course, other medical centers. And the phase will continue on. And it goes up to, it started from 600 people, going up to 800 people, and reaching 1,000 people for this phase per year, 500 on daily PrEP, and 500 on demand. Now, the last thing that I have to say is that we are pushing really hard to have this plan implemented, because we were lucky enough to have it exactly as we envisioned it, and we did not do this alone. It's always important to work with allies, and I would really like to publicly thank all the allies and all the partners and the groups and the stakeholders that supported this so far, not only EATG and AIDS Action Europe, but also WHO and ECDC that are supporting us. The Ministry of Health in Cyprus that allowed us to write the plan, propose it, and come up with this plan that we are really proud of. And also the local organizations that have been beside us and helping us with this advocacy. Thank you very much.
Thank you, Christo, and also Nadia and Mohammed for the insightful presentations. We will now open the floor for your questions and comments. Please raise your hands if you want to ask something, or you can, of course, send questions to Natalia or myself. So,
So can I kickstart the discussion by giving some more information about the North?
Yes, please.
I think it's important to say that, for anybody who doesn't know the reality of the situation in Cyprus, there are two sides in Cyprus. The north side that at this point is not controlled by the Republic of Cyprus, is controlled by Turkey, and the south that is controlled by the Republic of Cyprus. As the AIDS Solidarity Movement, we are working closely with organizations and groups and individuals on the north as well, although we are established and operating in the south. Now, the good thing, hoping that it will be implemented as it was submitted and approved, is that the provision is not through the national health system. It's through the Ministry of Health, which means that even if the national health system takes part in the dissemination of the medication, and even if doctors and pharmacies do participate in this dissemination plan for PrEP in Cyprus, that doesn't mean that it has to be the only part that will play a role, because the funding is coming from the Ministry of Health, and the national health system in Cyprus does not have a preventive character, a character for prevention. So the prevention comes from the ministry, and that means that if anybody wants to have access to PrEP and doesn't want to do it through the health system, what the officials from the ministry has told us is that they should be able to have access regardless of not being registered in the health system, which means that effectively undocumented migrants, anybody who is in Cyprus and in either side and wants to have access to PrEP and does not want to go through the health system for any reason, should be able to do so. There is a cap, which is the maximum users per year, and it changes every phase. So we need to be careful in the sense of making sure that everybody who really needs it has access to it. But from what we know from the launch on the 29th of May from the officials from the ministry, it is not a prerequisite that someone is registered into the health system, which effectively means that anybody who can, from the north side, who can cross to the south is either a Cypriot citizen or anybody who is in Cyprus and they are not necessarily documented with papers, could have access to it. And I am sure that we will make sure that people who really need PrEP should and hopefully will have access to it. Thank you.
Thank you very much, Christo. Ioan, you have your hand up. I hope I'm pronouncing your name correctly, though.
Yes, thank you, Yanis. First of all, I would like to congratulate Christos, Nadia, and Muhammad for all this inspirational presentation. And I have a question for Christos in terms of media campaign. I love your media campaign. I saw you are very, very often in the reflectors. Please tell me, how do you do that? It was difficult to put the subject on the agenda, on the media, because I'm from Romania, and I wish to have this discussion more openly, and put on the public media campaign agenda this subject. So yeah, how you do that?
First, I need to say that this is something that we were not good at, I would say. At least I can say for myself that I was not good at. I think that attending trainings, being an active member of networks like the European AIDS Treatment Group, like AIDS Action Europe, utilizing as much knowledge as there is out there from other activists, from other organizations in other countries, and understanding how other people did it and adjusting it to your reality. I think it made all the difference for us. I can see some of the names here in the list of the participants that have been advocating for a number of things in their countries, and we've learned a lot from them as well. It's not by mistake that I mentioned the PrEP in Europe Summit. Let me say that when we first started, and obviously there is a huge team behind me, huge, not necessarily in numbers because we are a small organization, but in hearts. We have a big team, a small team of big people, huge people, who are really spending a lot of time to work together and brainstorm and polish ideas and adjust them. So when we first started, I remember the first PrEP summit in Amsterdam. I came back to Cyprus after that summit, and we had the discussion, but aren't people going to have sex without using a condom? So I mean, we went through the same process that the officials in Cyprus were going through when we went to talk to them about that. So we also needed to work internally in believing in this. And how can you not believe in the effectiveness and in the human rights, the right to have access to all the tools, basically, and to allow people to decide themselves what is most suitable for them. So how did we do the campaigns? Brainstorming, having people sitting behind a presentation like this and discussing about the cons and pros and who we should approach first. And, you know, we did some trainings in choosing who are the allies, who are the journalists that we can reach out to, who are more friendly, how to approach politicians, the ones that are more friendly. I mean, it makes no sense to try to change the mind of someone who is completely against it if you don't have and don't create first an environment that is a supportive environment. And the most important part is starting from your partner organizations. We are not alone in this. Maybe you see just me presenting this here, but it's also Yannis, it's also other people from the organization, it's also the Cyprus Family Planning Association, it's Accept, it's Queer Collective, there are other people, it's Cyprus Refugee Council, there are other organizations that are close to us that are by default more supportive. Sometimes we do have to have difficult discussions amongst the community as well, but it's better to have them within the community and then move forward. So my first suggestion is that attend trainings, become members of international networks, be an active member in EATG, go to meetings, online meetings, listen to what other people say, and adjust them to your reality, because you know better what is the reality in Romania. I don't know if it answers.
Thank you. Thank you so much.
Thank you very much. So there was a question from Gus to Nadia. Have you found funding after PEPFAR? I think it was answered in the comments, but I mean, maybe Nadia wants to add something.
Yes, we just received this. You're talking about cabotegravir project. Yeah, we receive these drugs as a donation from PEPFAR, and even before February 2025, we also had commitments from PEPFAR for additional 500 courses. but and we supposed to receive them like shortly, maybe even now, but it was in stop after this USA regulation, and we still have communication with PEPFAR, with CDC, because these drugs for cabotegravir we have till the January 2026. And we in negotiation with donors, also with Global Fund. So we want to find a decision to support the clients and also to expand the program, but still don't have a answer from PEPFAR for this extension.
Okay, thank you.
Any more questions, maybe?
But in general, just also comments regarding lenacapavir and cabotegravir programs that last month Global Fund announced that Global Fund supported in the future this program, like all the programs that exist and all these commitments from Gilead for 2 million courses for the future. So like we are waiting for the update from Global Fund and PEPFAR for the final news, but the program with long-active PrEP will be and hope like also in our region more widely. Yeah.
Thank you very much. So if there are no further questions, sorry, Christos.
I have a question for Nadia. I'm just curious to know what the main barriers you had in Ukraine or you are having now while you are having access to PrEP, oral PrEP, and now you have cabotegravir, the 2-month injectable. And now you're planning, you know, when we have the lenacapavir, the 6 months injectable, what are the main barriers that you face in implementing these programs, and how did you maybe handle them or, you know, solve them if they are solvable?
Yeah, thank you for question. It's like it's really interesting to, and maybe not full answer for me, but anyway, I just try to answer that. First barrier, it's a lack of information for the new drugs. It's like also I just listening to your answer regarding media and media campaign. For the first steps that you should do with first drugs, you make targeting advertisement. So we just receive only 100 courses, and we just knew that we couldn't provide these courses for all key population, for the group. So we just we were really specific for the MSM community. We're really specific for communities that use internet, that just more like that because war condition and after COVID condition and also with this mobilization condition, we just can reach the clients only online. And online, this like now we can really provide and develop tools online because it works and reach, and also the government and healthcare facilities also changes to online providers. And secondly, it was like the answer decentralization, but the problem that it was only 2 spots for to receive this cabotegravir, to receive PrEP, because we couldn't, you know, internet, it's widely, and internet using in all Ukraine. So the people like answered from different cities, how can we come and receive the drugs? And the answer was only to come. because we couldn't send this by post because it's injection, you know, just so, and it just in case it still continue its information, because people have a big fear, people have myths, people just interpret themselves what is this, how it works and everything. And also it's a lack of information for medical suppliers, because medical suppliers also like very scared about this, how it works, and so just my advice for this, like specific, and try to work with target groups, and just try to decentralize all services like this. Yeah, thank you.
Thank you very much. So if we have no more questions or comments, we'll be reaching the end of this webinar. I would like to thank again Mohammed, Nadia, and Christos for their presentations and input, Natalia for all the technical and overall support, and EATG for supporting our work with Cyprus PrEP Point, and of course, all of you that attended today. So the recording and the presentations will be uploaded to the Core Knowledge Hub webpage. Feel free to check older and future webinars at your own pace, and keep an eye out for future meetings. Right after this webinar ends, you will receive a very short survey. Your input really helps us improve future webinars like this. And yes, that's it. Thanks again, everyone, for your work, your time, and your engagement, and stay safe, and see you soon.